1910. Find out more online at sanjuanregional.com.
Ten minutes past 8 o'clock. It is Wednesday morning, March 11th. Good morning, everyone. I'm Scott Micklin. Thank you for tuning in to KSJE 90.9 FM over the air in San Juan County, 103.3 FM over the air in Durango, Colorado, and you can listen everywhere from our website, ksje.com. Special good morning also to our viewers who are watching us live on the KSJE YouTube channel and Facebook page. We are glad that you are with us, everyone, enjoying this visual radio program. Coming up in just a moment, we're talking health care and cleanliness with my guest from San Juan Regional Medical Center. Stay tuned for that conversation starting in the next few moments right here on KSJE. Later on this hour, we'll visit with Dr. Mike Hadabaugh, who is standing by in the Encouragement Lab. That's coming up about 8:50 this morning with Dr. Hadabaugh. He's going to be talking with us a little bit about believing, not believing the hype. That is the message this morning. We'll talk more about that later on this hour with Dr. Hadabaugh today on KSJE. Mick S. is here next hour, Roving with the Arts. It is our weekday classical music program. And this morning, Mick is playing the great piece of music, Carmina Burana. That is coming up today on Roving with the Arts. And that takes us to 10:30 for our local and regional author program, Right on Four Corners. Tracy Hales-Vass is speaking with author Thomas Voigt about his book, Stand in the Light, a great collection of native photographs and stories. That's coming up this morning at 10:30 right here on KSJE. Don't forget, of course, in addition to Facebook and YouTube, you can also follow us on Twitter and check out KSJE on Instagram as well. And our weather forecast, we are talking scattered showers again today with mostly cloudy skies, the high 56 in Farmington. 39 with some showers overnight, then a partly sunny day tomorrow with a high near 60 on Thursday. Showers again Thursday night with a low of 42. Scattered showers on Friday with a high of 53 and a low of 35. And some more scattered showers in the forecast for Saturday with a high of 56 and an overnight low of 32 degrees. And of course, we always tell you that visual radio can take you places. We'll take you to a place where it's not raining yet, although it's in the forecast. But this is St. Croix in the U.S. Virgin Islands, where it's currently 79 degrees on the beach at St. Croix, on their way to a high of 85 and an overnight low of 73. But they do have about a 50% chance of scattered showers today, even in the British Virgin or the U.S. Virgin Islands today as well. But let me turn to my guests who are back here with me in a cloudy Farmington to talk a little bit about healthcare and San Juan Regional Medical Center. Laura Werbner is here, the public relations specialist. Good morning.
Good morning.
Welcome back to KSJE.
Yes, thank you. I love to come here.
Good to have you here. Also, Utana Ortiz is here. Good morning to you.
Good morning.
And you are in charge of environmental service management at the hospital, correct?
Yes.
And so we'll be talking with you about what that means, and you get to use robots.
Yes, I do.
It sounds like an awesome job. But Laura, let me start with you a little bit about what's on everyone's mind, and we want to talk a little bit about this coronavirus and COVID-19.
Yep.
And to reconfirm, there have been no confirmed cases in San Juan County in New Mexico.
Correct.
To
Yep.
date. I know there's some testing going on.
We're still, things are changing daily by the hour,
Minute by minute. That's
and
right.
We're, continuing to keep up with it. So, as of right now, no confirmed cases in New Mexico, but of course at the hospital we're planning, we're preparing, we're getting ready, we are here. People are nervous. People have a lot of questions, and so we want to try to reassure them and let them know what we're doing and
right.
So what they can do as well, so they can just kind of make sure they try to stay protected and protect their families.
Sure. But again, a lot of the things that we should be doing because of the flu anyway. It seems to me, and I'm not a doctor, but it seems to me
Yes.
washing our hands and just keeping our distance and coughing into our elbows are normal things that we would do anyway
All
during the
those
flu
things
season.
that we should be doing, and we don't always remember to do them, but if there's one big thing that, everyone at the hospital really has been pushing out there, it's washing your hands and how important washing your hands is to prevent the spread of germs. But also a really big one is don't go to work when you're sick.
Right.
And people do that. People feel bad, like if they miss a day, everybody else is just gonna be so upset because they're gonna have to take on their load. No, everybody else will be upset if you make them sick.
Right.
Stay home.
That's true. That's true.
Stay home. Don't give it to anybody else. That's a big one, an important one. And the sneezing and the coughing, exactly, to cover those things, to throw those tissues away, to just decrease all the places where you can leave your germs.
Right.
and clean and disinfect.
And wash your hands.
And wash your hands.
And don't touch your face.
Again. And that's very hard. You're going to say, don't touch your face, and then you're
And then we're going to be sitting here, but we're not going to do that.
But, sit on your hands or something so you
That's
don't
right.
touch your face.
That's true. Exactly. Now, the hospital, to its credit, I believe, has been very proactive in setting up a hotline. If folks did have questions about this virus that they hear about in the media or other places, or, God forbid, social media, which may not always be 100% reliable.
That's true.
So we can
Couple
call.
points. So, yes, we have a hotline at the hospital that we're updating daily, just staying abreast of the information. We are in contact with the State Department of Health, the CDC. We also have a really great community with all the different agencies in our community, all the leaders. We get together, we're meeting, we're discussing.
And they have been meeting
together.
too,
Yeah.
I think, for the community to understand. I mean, the county Office of Emergency Management has included the hospital and others in these meetings to just get everyone on the same page of what's going on.
Schools,
College.
home health care, exactly. We're all working together because this is something that could affect our entire community. So we're all in this together. So we all want to be on the same page and making our plans coincide with each other. So as far as the hotline number goes, we're gathering that information. We're updating the hotline daily. We've got 2 phone numbers. They are on our website, but I'll also give them to you. It's 505-516-0938. And then you can also call toll-free at 888-949-5387.
Okay.
And we don't have a live person who is, responding to calls. It's a recorded message.
Okay.
There is a number we give on that message if somebody has some immediate concerns that they need to call somebody about, which is a number for the State Department of Health.
Got it.
Yeah.
And that's kind of the lead agency in our state that's taking then their information from the CDC, which is the national center, basically. So there's a unified response to what we're talking about.
Exactly. And I do want to just let people know that the State Department of Health is ultimately the agency responsible for deciding who is going to get tested.
Not the hospital, not your doctor, not...
So, you can't just walk into your doctor's office or the hospital and say, I want to be tested for COVID-19. That's just not how it works. So we do want to kind of let people know that process and understand that they must have symptoms, and then the provider would work with the Department of Health, and they would make that decision together to decide who should get tested and who needs a test. So.
And the issue, I guess, there is that there's a limited number of tests available in our state, and they want to save them to make sure that they're testing the most serious people that are presenting with what could be this
Exactly.
illness.
Yeah, exactly. And then, of course, the testing backlog that could result in so many tests going out, and then the state lab trying to process all those, and then the results being delayed because of that. So we got to just do our best to trust in our medical professionals and know that they have our care and our best interests at heart, and if we need the test, they'll get it to us, and if we don't, then there are other things that I'm sure that they can help with and do for us.
Right. Yeah. True. Good point. And good information. Thank you for coming in to share that with us this morning.
No
It's very great. And again, the hotline numbers, would you share them one more time for our viewers and listeners?
Yes, 505-516-0938 and 888-949-5387. Those numbers are on SanJuanRegional.com. We also have a whole section of our website set up with coronavirus information, and we encourage people to go to the sources that we know are reliable sources to get their information. So you can go to SanJuanRegional.com/coronavirus, and you can go to the CDC, the State Department of Health. Those are really some great resources that have a lot of information, and you'll get truthful, accurate information there. We don't want to be spreading any misinformation that, like you said, could pop up on social media.
You mean the meme that I saw my aunt's boyfriend's mailman post on Facebook may not be accurate information, Laura? I can't believe
I don't know. I'd have to review it to find out.
I understand. But that's great, and it's important. And again, I know we have it on our website, too. We put a news story in our news section about the hotline and the website. People can go there as well, KSJE.com, and connect there. So wonderful.
Please do.
Very good. Thank you very much. Yeah. Laura Ruger from San Juan Regional Medical Center. And now, Yutana Ortiz, I want to talk a little bit with you about your job at the hospital as the Director and Manager of Environmental Service Management, and that is making sure everything is clean at a hospital. And that is a big job because there's a lot of dirty things that go on at the hospital.
There's a lot of dirty things.
I didn't mean that to sound the way it sounded. I really didn't. But I think you all know what I mean.
Well, things can happen in a second.
That's right.
We could clean an area or a patient room, and next, 10, 15 seconds later, we're called back again, said, there was an accident. So
Right.
we're called back.
So you're cleaning it up again. That's
Cleaning
true.
it up again, and that's just the story of housekeeping.
And so you have regular, I guess, duties, and then, of course, we were talking that with this COVID-19, but also just the regular flu season, there's probably some additional things that you and your crews are asked to do to stay on top of these things, right?
We do. We do terminal cleaning, is what it's called. And basically what that is we're doing a top to bottom clean. So we're mopping the walls, we're taking down the curtains in the room, we are wiping everything top to bottom, all vertical, horizontal surfaces, and just to ensure that if you're a patient in our hospital, that there's no cross-contamination, and that's our biggest goal. Is we don't want our new patients to come in and get what the last patient had. So, and we also do some preventative measures to ensure that our staff are following the correct process. We do nothing as exciting as our robot, but we also do glow lights. What glow lights are is, say there's been a discharge. We go in, we take a little marker, and we mark all of the high touch areas of the room, which could be your remote control, the door handles, the sink handles, all of that, and we mark it, and then we let the housekeeper go in there and they clean the room, and then we go after them with a black light to see if they got everything in the room. And so if they did, they get 100%. I give them a free meal ticket to eat upstairs in our cafeteria, and then if they don't, then we put in the training there, additional training. How do we get better? How do we improve? And so, we're all human. We all make mistakes. And sometimes in cleaning, it's so repetitive, too, what you do every single day, every single room. They all, after a while, they look the same. Like, did I do it? Did I not? So,
right. And but they can see it. And you can see it, too, right? By using that technology, it sounds like, right? And
Absolutely.
be able to see it pretty visually of what got hit and what got missed, perhaps.
What got missed. And it's very visual. It's right there. You see it like, hey, if that mark is still there, you can, it comes off really easily if you do clean it.
Right. Now, you mentioned robot, and that's, of course, got me all excited because you get to work with robots. And so this is something relatively new. And San Juan Regional, is it the only hospital in our state that's using these things?
Yeah, it's actually not new to San Juan Regional. We've had it now for about 3 years.
Okay. Trudy.
Trudy UV
right.
light, yes.
Okay. And we have a picture. If you're watching, you get to see what Trudy looks like. But there she is. And she's pretty impressive, I must say.
Yeah.
And so talk to me about how this works. She's got a lot of lights on her, and she rolls into a room, and what does she do?
Okay, we roll her into a patient room, and then what we do afterwards, we roll her in a patient room. She has a remote control, so you can't be in the room while she's operating. If you do, you will you'll get a suntan, and not only that, is that you'll burn.
Okay.
You don't want that, and what it does behind it, it uses UVC technology, which is technology from the sun. So what it does is it eliminates human error. Like I said earlier, sometimes we make mistakes, we miss something, and this gets everything in the air. Everything that the air touches, it disinfects. And it's 99.9% effective. And so what it does is it takes spores, viruses, and it breaks it apart so it doesn't regrow. And so we put this in all of our rooms, all of our patient rooms, those any isolation rooms. So if we have a COVID-19 patient, or we have
which we have not.
No, we have
just
not.
To be clear,
a flu patient, or C. diff patient, MRSA patient. We put this in afterwards as an addition to what we do. So, like I said, it has a remote control. We start it, put it on. We have panels that are the door stoppers of the room. Basically, they have signs that says "Do not enter this room while it's operating," and it'll tell you. It measures it. So each room is different. It depends. There's little sensors at the top. It'll tell you how long it's going to take. So, like this office, it goes off of the square footage of the room.
Okay.
So they're all different, and it measures it.
About how long would it take, maybe on an average hospital room, would you say?
Our patient rooms, they're bigger, so they anywhere between an hour to an hour and 15. It just really depends on what's inside of their room. If there's no bed, if there's more equipment in that room that patient had, so it does take longer if that's the case, because it's disinfecting more items in the room. So, and then it's so cool because it'll even text you when it's done. and says, "Hey, come
Well,
pick me
that's
up."
thoughtful.
Yeah,
Yeah,
pick
there
me
you
up.
go.
I'm ready to go to the next room.
Right, very polite. Very polite robot. I like it.
And it talks too.
Right, wonderful. And now you've been using this for 3 years, you said, right? And so obviously you've got some data or some results from these 3 years, and so obviously it must be working pretty well.
It does. It does. I mean, but it's a collaboration between us and nursing, and a lot of the protocol that we've put in place. This is, like I said, it's just an addition to what we do, and just to addition to our cleaning. So there has been results where we reduce hospital-acquired infections, but I can't say 100% it's because of our machine. But like I said, it's a collaboration with nursing and a lot of the steps that we put in place.
But another tool that you and your staff can use
Yes.
to ensure that these rooms are clean. And I imagine some of these airborne things are maybe some of the most difficult to eradicate from a hospital setting.
It is. It is. It is some of that. But we have negative pressure rooms, and that's perhaps what the airborne airborne, I guess, the airborne diseases and that stuff is.
Sure.
Basically. And so with those negative pressure rooms help with that. But this is an addition to of that. But
Gotcha.
I mean, it's a nice machine to have. We are the only hospital that has this type of technology. There are other ones on the market, but this one measures it. So like I said, each room that you put it in, it tells you, okay, I'm going to put this in there. It measures everything. Other ones on the market, it's not like that. You basically are putting it in you put it in the middle of the room. 5 minutes later, you're coming and moving a foot forward, and another foot, another foot. So, I mean, this one, it's like you put it
Pretty
in,
automatic.
you walk away and say, hey, come get me. And, it's and we have two of them.
Two of them.
Two machines.
Nice.
Two machines, yes.
Very
So
cool.
Very excited about
And
that.
they have names, and I think Utana should share that too.
Oh,
Yes.
okay, not just Trudy.
Not just true.
Okay,
we
so
have two of them.
but
Yes.
right, you can't have Trudy 1, Trudy 2. That's boring. What do you get? What do you got?
Well, we have one in place. Well, at first we were really wanting to go. I thought it was going to be like R2D2 or that, but no,
Right.
we've actually settled with Thelma and Louise.
I like it.
Yes.
I like it.
Very cool.
Very nice. Well, that's awesome, and again, it works, and it's not just awesome, but it works. It does the job that it's supposed to do. So that's the cool part about it. And you're also looking for new employees, right? I mean,
am.
you're hiring, correct?
I am
What types of
hiring.
things are you looking for?
I have all shifts, a day shift, evening shift, night shift. I am looking for people.
Would I get trained on the robot if
Absolutely,
I?
absolutely.
Well, sign me up.
My management team, I think will have a really good support system there at the hospital, and they take on a lot of the training that we do. They're like a 2-week training, with 1 week with my assistant manager, and the second week with my supervisors or a knowledgeable employee. So we don't put you out right away and say, hey, you know how to clean your, that is how we've set people up to fail, and we don't want that. We want to be successful where we're at. So we take a lot of pride in what we do, and my management team they get a lot of credit for that.
Sure, right. And Laura Werbner, I would think that, if I think I can clean my house pretty well, it's a whole different level of cleaning when we're talking about hospital level cleaning, are we not?
It's amazing. I have followed them around and done a story on them, actually, kind of looking into all the different things that they do. And it's amazing because, they have color-coded rags. You don't clean this part of the room with the same rag you clean the bathroom with, and
Right.
just things that, make common sense, but you don't always think of, because I just take paper towels and I just clean everything. They do, and it's such a huge area that they clean. I mean, we have a large hospital, and the laundry that they do.
Oh, I can't imagine. Yeah.
Utana has statistics about that, and the statistics always blow me away because there's so much that goes on in the hospital, so many people who go through it, and all of it has to be clean for our patients, and they are right at the center of that, and they do an amazing job keeping
Nice.
up with it.
Utana, how big is your staff, would you say?
I have 45 environmental service staff, and then I'm also with the laundry department. I have 4. Then I also clean all of the clinics for the hospital too as well, and so a total of 70 staff.
Wow.
Yeah, it's a big department. Yeah.
That is a lot.
Yeah, and so we do everything. Everywhere we're, the same type of cleaning that you get in the hospitals, the same type of cleaning that you're going to get in the clinic buildings. When you go to urgent care, someone pediatrics, all of them is the same type of cleaning, same type of training, and we standardize everything so the housekeepers know how to clean. And if they come into an isolation room outside in the clinics, they know what to do and how to handle that and what process to follow. So.
The procedures are the same no
All
matter
the
where
same,
you are in
no
the San
matter
Juan
where you
Regional campus or wherever throughout the town,
Yeah,
in the
absolutely.
county.
We think of the worst case scenario, and it's like, okay, this is how we clean top to bottom, and this is how we ensure our patients are safe, and that's our number one priority in our department. So.
Interesting. And I know that this is part of the overall kind of philosophy at the hospital, Laura Werbner, about making sure that even the staff and doctors and the nurses and the assistants and everybody else is washing their hands and doing all that and keeping cleanliness and all that at the top of mind as they're moving around through their daily routine.
And we like to tell people it's okay to ask. If you are a patient and you see a caregiver who doesn't look like they come in, it doesn't look like they've washed in, it's okay to ask them to wash their hands. People are really used to it and they do it all the time, but sometimes something could happen and they could forget. And if we forget, remind us.
Right.
It's okay.
Sure.
It's okay to ask.
Or they would do it again, maybe if they just did it, but the patient would feel more comfortable.
Yeah,
they would probably be glad to do it again, don't you think?
Absolutely, yeah.
That's true.
That's for sure true.
Very good. Utana, what are some of the things that folks maybe are surprised to learn that they do when they come to work for you?
Were they surprised to do?
Right.
Clean blood, body fluids.
That'll do it. Yeah, that would do it. Sure. Right.
You see that more
part
often.
Of it.
Yes, and
there's a procedure to do that properly and correctly, of course.
Yes, there is. I always get when I get moms, they're like, "Oh, don't worry about it. I might have babies. It's like, but our babies are different. They're so cute. It's like, oh, they pooped the first time. I love this. When you come to the hospital, you're like, oh my God.
Right.
But you see that every day. And it's very hard work. I mean, the very first 2 weeks, I tell people, are the hardest because you're learning, especially if you haven't done something in this type of environment for. We're patient with you, we work with you, and make sure that you're successful in the role that you're doing at the hospital.
Right. Laura?
I have something to add about that because I want to just share it with her department and environmental services. You're not just going in and cleaning. You're a huge part of the patient care team. You are a huge part of the patient experience. Her staff and everybody who goes, in and out of patient rooms, they're interacting with patients. So if you want to be more of a, just clean and not have to talk to anybody, there are roles that she has for that. But a lot of the time, the people that are working in the environmental services, they're interacting with patients. They're part of the caregiving team. They're talking to the people, and the patients really appreciate that. And environmental services has a lot to do with those positive patient experiences.
That's a good point. So bedside manner, I guess, is important for your department too.
Absolutely, we teach that hands-on training. We put that part of our training is talking with patients, and I get a lot of compliments on my staff. They go above and beyond. Some of them that are bilingual, they talk to the patients, and especially if you're taken from an environment like your home and you're not used to being in a hospital, and find someone that speaks the same language you or the same culture as you, they can relate right away and they feel comfortable. And they'll ask the housekeeper, my doctor said this. Do you know? She's like, I don't know what that means, but I'm pretty sure you're safe. You're safe here. Whatever they have the right protocol, and just that extra insurance from the housekeeper, and I think that says a lot. And we get a lot of good compliments. I had a grandma one time. She was an elderly patient. She came in and she was by herself, and she right away, the housekeeper spoke Navajo, and she had right away made that connection with her, and she just said, she made me feel at home. I wasn't scared, and just talking with her in our native language and really getting that insurance just helped me with my healing process, and that was very cool, I thought.
Nice, very good. My guest this morning from San Juan Regional Medical Center. We are talking about healthcare and cleanliness at the hospital these days. And are there any things that maybe you learn or your staff learns in their training that they can then take to their homes? I mean, not that you have to scrub the walls down at your house every day, but I imagine there's some techniques, though, that could really make your house the cleanest on the block.
Yeah, I think one thing that the housekeepers, we talked about as our disinfectant with the wet times, that is a big, and it's on all of our Lysol and bleach at home, is that you have to allow the surface to stay wet for a certain amount of time to kill all those germs. A lot of us, what we do is we take, wipes and that stuff, and then we take a paper towel and we wipe it off right away. You're not allowing that wet time to adhere to kill all of those nasty germs.
Interesting. I didn't know that myself, so now I need to go home and clean my house.
I know.
Right?
Tips and tricks. I like this.
Exactly. Very good. Very good. Well, I appreciate both of you coming in this morning and sharing this really great information, and we are just about out of time. But before we go, Laura Werbner, if you would share the hotline numbers yet again that the hospital has set up, very proactively, I might add, if you have questions about the coronavirus, also known as COVID-19, that is kind of the the virus that's causing this.
Yes.
And so we can call the hospital, and you are updating that number with the latest information you're getting.
Anytime there's an update, I am re-recording that message and putting it out there. So give us a call at 505-516-0938 or toll free at 888-949-5387.
All right, good information. And again, to repeat, there have been no confirmed cases of coronavirus anywhere in New Mexico, anywhere in even La Plata County, Colorado,
Right.
even in San Juan County. And the testing, though, does continue if folks have maybe suspected of maybe being exposed or having this. But so far, the number is still 0. So.
Yep. Just keep an eye on it. We're keeping a close eye on it, and we're here to help our community in any way that we can with whatever happens.
There you go. Keep washing your hands and
Yes.
don't touch your face.
Go home and wash your hands.
That's right. Laura, thanks for being here.
Yes.
Always appreciate it very much. Utana, Ortiz, thank you for being here as well.
Thank you.
Thank you both, my guests here on KSJE. And I'll be back with more, everyone, in just a moment. The time right now is coming up on 8:35.
Program on KSJE is supported by Citizens Trust and Investment Corporation, providing a competent, innovative, and caring team of professionals to serve wealth management, trust administration, employee benefit plans, retirement planning, and estate settlement needs. Find out more about Citizens Trust and Investment Corporation at 505-59